Hello, everyone, and welcome to another Insights from Women Leaders event. My name is Rola, and I'm the CEO of Salus Vitae Group, and I'll be the host for the event. Now, for those joining us again, of course, another welcome to you in this event. We've been having these events since October of 2020, and so it's always nice to see several familiar faces or familiar names in the attendees. And then, of course, those that are new to the series, welcome. We're so happy that you are joining us for the event today. Now, a little background on the series. Like I mentioned, we launched in October of 2020 as a platform to hear from women leaders with varied backgrounds and experiences on the topics of leadership, addressing current and future challenges, what skills we need moving forward, and how their experiences have shaped their outlook. Now, the goal is to learn from women thought leaders and decision makers to empower current and future leaders, both men and women, to positively impact their organizations and communities. Now, diversity of thought, experiences, industries, and education and training are important to us as it highlights the mosaic of perspectives that are represented in different settings that help drive decision-making and positive change. Now, our guest leaders have included leaders from various prestigious and reputable institutions from across the globe. Now, their backgrounds are diverse, their accomplishments many, and the insights and perspectives they have provided have been very valuable. I encourage everyone to check out the recordings of all of our previous guest leaders if you haven't already done so. They're all available on our website. Now, over the course of an hour today, we're going to ask our guest leader a number of questions. I'm going to start first, and then we actually will open it up to the audience questions. So please submit any questions that you have in the Q&A box. You can also submit them in the chat, but we tend to look at the Q&A box first. We also encourage you both during and after the event to post any key takeaways that you have from the event in the Q&A box or on various social media platforms, and you're welcome to tag us at Salus Vitae Group. We always love to hear how you benefited from the various experiences and perspectives of our distinguished guest leaders. Now, this session today is recorded and it will be available for replay after the event. So let's go ahead and get started. I'm pleased to introduce and welcome our guest leader today, Dr. Mary Ann Kliethermes. She received a BS or Bachelor's in Pharmacy from the University of Michigan in 1977. Go Blue, I just have to say Blue. Her Doctor of Pharmacy from the Philadelphia College of Pharmacy and Science in 1981. Her career includes clinical practice and management in hospital, home infusion, ambulatory practice, and academia. Her current position is Director of Medication Safety and Quality at the American Society of Health System Pharmacists. Her expertise is in pharmacy reimbursement, medication optimization, safety and quality attainment associated pharmacist services, particularly in new healthcare models and value-based payment systems. She also served as the chair of the Section of Ambulatory Care for ASHP, or the American Society for Health System Pharmacists, and represented ASHP at the Joint Commission Ambulatory Professional and Technical Advisory Group, the Care Transition Work Group of the PCPI, and the Ambulatory Patient Safety Technical Advisory Panel for ASPE or /HHS. She's a member of ASHP SAG on clinical practice advancement. She's contributed to Pharmacy Quality Alliance since its inception. She's also served as the chair and executive committee and board member of PQA. She's the past chair of the APhA PCMH /ACO SIG. There's a lot of acronyms in healthcare. Mary Ann has been awarded Pharmacist of the Year, Shining Star Award, and the Amy Lodolce Mentorship Award from ICHP, the Distinguished Service Award and the Distinguished Leadership in Health System Pharmacy Practice from ASHP, and the CCP Outstanding Faculty Award, as well as the Daniel B. Smith Practice Excellence Award from APhA. Excuse me. Now, welcome and thank you so much for taking the time to be with us today.
Thank you so much. I'm really honored to be part of this very elite group of women. I'm very honored that you thought that much of my work. Thank you.
No, of course. We're very excited to have this conversation with you today. Like we mentioned each time, and we had talked about this before, we always start out and we ask our guest leaders very similar questions, and we always start out with the same question, especially as we go through, and like we had just gone through your impressive bio, even as you sit here and think about it, did you expect to be where you are today?
Oh, absolutely not. Absolutely not. I actually have somewhat of a funny story, is that one of my classmates at Michigan in undergrad, so this is the BS degree, was really a good friend of mine. He dated my roommate. I mean, it was, he was a really good friend of mine. And it's, we are now working together at ASHP. So what is that, 43 years later? And we both looked at each other and said, boy, would we have ever thought this back then when we'd sit in those classes? And we didn't at all. It's funny how life takes its turns and you just make decisions and things happen. And Paul, my good friend from college, ended up being director of pharmacy at Duke. And who would have thought that back then? We wouldn't have, for sure.
Yeah, no, it's exciting. I think it's always nice too when you think back and when you think, oh, I didn't expect to be, but there's like always a smile on your face, right? Like, yes, so there's so many guest leaders where it's like, yeah, but it turned out wonderful, right?
Yes.
And just to kind of think about that.
Yeah.
So many of our conversations start off with the future first. So as we're give very small snapshots so far of what you've done, let's spend a little bit of time in the future. So what's in your future? What do you want your legacy to be?
I chuckled with this question, Rola, when you provided it, because I am good enough over 65 already. I plan to work till I'm 70, which is really 3 years away. So my future is actually retirement. I don't know that I will totally give up, some of that expertise. And I suspect, as I know Mary Alice Bennett from Ohio State, she gets pulled in quite a bit, but I hope to enjoy my grandkids, to travel. I am up here at our retirement home, which is on a lake in Michigan. So that is in my future, but I don't see myself giving up some of the mentoring that I've been doing and the good friends that I've made over the years. I suspect that will still continue. So that's my future. So it's a little bit different than I think many in your audience, and even some of the women that I've listened to in your interviews, who really are still in that what's next, what's next, and I probably was there maybe 20 years ago, but not there now. I have the luxury of looking back and saying, wow, I have that luxury of looking back and saying, I can be proud of my work that I did, and what I gave to it.
So do you think a lot about legacy? Is legacy kind of a top of mind, or? Legacy
was never what drove me. I will tell you that. I discovered what my passion was, and I think I discovered it fairly early. Rosemary Berardi, right? From Michigan. So, I was going through the curriculum, and I really enjoyed learning. I've always enjoyed learning, but it was really when I had those opportunities to do direct patient care, which was very novel and new back in 1977. And, then I went to Henry Ford, and they were just, as my first job, and they were just creating those kind of positions. And I realized that that's what I was good at. I was not so good at the detail work of checking unit dose carts, checking IVs. It just was not it's just not who I am. It wasn't my makeup. And I wasn't so good at it. I remember some mistakes I made. And I think it's just not in my DNA to be, to do that kind of work. Very important work, but, and there were people that I worked with that did it very well, but my mind would wander. I'd lose attention, and where I didn't when I was constantly interacting with people. And so, I realized what I was good at, and that kind of drove me on to get my PharmD and do the work, go the path that I went. So I never thought about legacy. I thought about where my passion was. And so I knew it was people that I needed to interact, because, you know, checking unit dose cards or checking IVs at the end of, you're just pretty silent most of the time. And that wasn't really my, you know, it wasn't working for me. And when I started doing patients, but then when I started seeing patients, it was patient safety. It was adverse events early on in my career that are seared in my memory, the visions of those patients. There were 3 of them in particular. A patient who died of phenytoin-induced, it wasn't toxic epidermal necrolysis, but it was one of the rashes. And then I had a very young patient who was very sick with neuroleptic malignant syndrome from her antipsychotic, and toxic epidermal necrolysis from vancomycin. And I'm thinking, these people were so sick and it was drug induced, and there's got to be a way. Like, that became my passion, you know, to safety and quality and adverse events. And so passion drove me, not legacy. You know, what I really felt I could make an impact on.
So do you think of legacy as how you would be remembered, or how do you then maybe think of legacy?
I think of legacy over the years, you know, now that is really my legacy, I think, is who I mentored, and how I was able to understand the landscape and make decisions and how best to do things, how best to take care of patients. What does that entail when you're a clinical pharmacist? How best to manage people? I think management is a very interesting area, particularly in healthcare. You know, I have to tell you, my husband is a pharmacist, and he went the MBA route. You know, he went and got his master's in business, and he's not clinical at all, but he didn't need to be. He had me, and I didn't need to be management. I had him. But there were times as I moved into management that I said to him, isn't this just all common sense? You know, you really went to school and we paid that much money. No, but you know, a lot of it, but it's interesting as you go into management to understand management styles. And then when I went into academia, I actually taught this course, and I did some research into it. And it's very interesting to see healthcare and how they've evolved and the history behind it, and how healthcare management has evolved versus other industries, and management styles, and what's a current management style and what's a traditional management style. So I think I came to the current one by accident, just by looking at, observing, and observing people, observing what gets done, observing that when somebody really enjoys what they do a really good job, but when you put them in somewhere that they don't want to do it, they don't do a good job. So, you know, it seems like we need to really pick the right people. And just some of those observations as I moved up into, clinical services management.
Yeah. So as you also start thinking about the future, or really thinking about your current outlook or outlooks that you kind of have, as you think about new initiatives or new programs, have there been any challenges that have really shaped your outlooks? Maybe, as some would say, some maybe failures or challenges that have really shaped how you look at things now into the currently, or really into the future, and maybe you would have wished you would have done things differently, or will do things differently moving forward?
Yeah, you know, of all the questions that you have in these interviews, this is probably the toughest for me. And I don't know, I was trying to understand that, because, you know, when you do those various personality, or my top, I forget which one it was, but my top is positivity. So I don't fret over mistakes or even dwell on them. Many of them have occurred. But I look at, I even teach my kids and the students that it's okay to fail. It's okay, because you learn. Those are all learning. I've learned so much when I've, one particular mistake where I really learned how to pick the right person for the right job. I remember hiring a particular pharmacist who really was not the right person. She was incredibly smart, top of her class, but there were other skills that just didn't make her work in this position. And she was miserable and I was miserable. And I learned that it's not always all about the GPA or the ranking in the class. There's a high importance in critical thinking and soft skills that may make us, somebody with a 2.5 GPA much better in this position than somebody with a 4.0 GPA. And so it's the package. And I've definitely learned that over the years, and even have counseled students. It's okay, you failed this course. That doesn't define your rest of your career at all. It's how you pick yourself up and learn from these mistakes. So that was a management mistake, but I've certainly had failures. My husband and I tried to, in the late 90s, develop software for clinical services. And I still think we had a great idea, but it was not easy. And, we didn't succeed. And we learned a lot. It's hard to be a small 2-3 person business and get something that big going. And it's also hard to be way ahead of your time in what you were thinking. So those are some maybe personal ones, but I tell you, the ones that bother me the most are the patients that I wonder if I could have done more, who didn't have a positive outcome. And, again, maybe starting from those adverse events, it's seared in my mind. I have those patients that, that either died or, I couldn't get them to where they wanted to be or where we wanted to be as healthcare providers. And I think about them often, and I think about them because what can I learn from how I can do it better?
Yeah.
So
I think that's powerful.
Yeah, I don't dwell on it. I mean, I know people do, but I tend not to dwell, but learn. Maybe it's this love of learning that I've always had that has helped me a lot, that I'm always wanting to learn. Yeah.
I like the different elements of how you mentioned to not, sometimes we ignore what we quote unquote think are the simple things, which are like the soft skills, right? That actually end up being a challenge for many people because you overlook actually a very important element of how you work with people there, how they are able to contribute. And like you also mentioned too, what we might deem as failure are actually opportunities that we would have thought like, hey, let us, first of all, acknowledge the fact that you had to do a really hard thing and you might have failed, you might have been successful, but you did a really hard thing. And so I think that's also very powerful there. And I think the element of always thinking about what more we can do, right? So not to position it as a quote unquote failure, but just to think there's always an element of what additionally could we have done that we could do for the next patient with regards to patient outcomes. I think those are wonderful take-home.
What can you learn from this? Do you know what didn't work? It's that reflective, critical thinking of okay, how can I do it next time a little bit better so that I get a better outcome, in the same kind of circumstances. I mean, it's just really critical thinking. I think an assessment that say, wow, this didn't go so well. Like, what? Okay, next time I'm going to try it this way, and I wonder if that positivity also plays a part, because I will tell you, my husband isn't like that at all. Sometimes he will sit and mull over something that happened, and I want to go, move on.
You're like, I think it's fair. I was listening to this thing and they were talking about like, you give it enough time, but then if you're constantly reevaluating it and you're not thinking differently or adding to it, you're not going anywhere, right? You're staying in that same circle. So that's fair. So what excites you about the future? What are you looking forward to?
Professionally, I'm going to say that I think we are on the cusp of potentially, look at all these adjectives, of some movement on reimbursement for pharmacist services. I think, I think the tide is a little bit turning. And if you know me, I've worked on this since for the past over 10 years, because as I went into ambulatory, it was easier in the hospital, but as I went into ambulatory, sustainability of the services that we pivoted our educational system to, with therapeutics and, clinical services, because of a need that was identified actually in the 70s and actually at University of Michigan, that there are so many medications being approved, that was a dramatic escalation in that time period, that a group of physicians and other healthcare providers came together and said, we need somebody to be responsible for this because we can't. And they were the ones that encouraged the changing of curriculum of pharmacy to be more therapeutic. And so that happened in the 90s, right? But yet we haven't realized the kind of practice I've done for 40 years, and it's all because of financial sustainability. And that has been a big challenge. But in the future, I think we're starting to, I think we're hitting it. It's taken a long time, but I think there is a more interest from stakeholders that are outside of pharmacy, understanding that this is an issue. So I look forward to that. I always say, well, I'm going to retire when pharmacists can get paid. But, I may retire. We'll see. We'll see how fast that happens. But the conversations are changing. So I do look forward to that. I think the conversations are changing outside of pharmacy. When I would go speak to people outside of pharmacy, it just boggles my mind for something I've done for 43 years that many don't understand or have heard of. So that's kind of interesting.
Yeah.
So that's what I think. I think that it will happen, and we're getting closer. And I think the alternative payment models aid in that.
Mm-hmm. So as we're thinking about whether it's this topic or maybe other challenges that we are currently facing or will face in the future, what tools do you think we need, or how do you think we need to kind of build our skill sets or focus on to address some of these issues and maybe be ready for them when they do arrive?
Yeah, I think, I have said this several times, is that I think as we move this forward, as a whole, as pharmacy has to get their house in order. And I think some of those things that pharmacy has to get their house in order is we have to be a little bit more united. We can't be fighting against each other. And, and I've heard, this is not me saying it, but I've heard other pharmacist leaders say that pharmacists like to, circle the wagons and shoot inward instead of shoot outward. And, so we can't disparage any practice within pharmacy. No practice is better than the other. We have to recognize that the medication use practice, of which pharmacists fall into the whole gamut, and as they fall into that whole process of how medications are used, there are different skill sets, different needs. There are populations that have different needs. The kind of work I've done is really that very high risk, complex patient, comprehensive medication management. And there is a, high cost, high risk population that needs that kind of service. But not everyone needs that kind of service. There are those who need the patient care services that are provided in those 10, 15-minute consultations in a community pharmacy. What we need to understand is it's not so much where we practice, it's what the population needs, and how do we fit the right pharmacist in the right place to meet that right pharmacist's needs. So we can't disparage any part of pharmacy. It's incredibly important to get the correct medication to the patient, but it's also incredibly important to have that skill set to help those patients monitor and manage their medications, or to be in the intensive care unit and help the team manage and monitor some very high risk complex medications. They're just different jobs in that whole use process. And I think we do a disservice to our students sometimes when we don't help them figure out where they fit the best and follow the right path for themselves. You know, I was kind of lucky that I figured it out, I think young, that I knew I couldn't go in one path and I had to find another path. And I think that's what we need to do. I think those are a barrier until we as pharmacists understand that there are different jobs and we need to support each other in each of these. So, you know, the American Society of Hospital Pharmacists needs to support the National Chain Drugstore Association because they have an important job, and they have to support American College of Clinical Pharmacists because they have an important job. And so we need to you know, we need to understand how we do that, and we need to communicate among ourselves. So I don't know if any of you out there, but it's always fun. I almost call it fun when I have been in the clinic and I'm getting a hospital patient being, one of my patients being in the middle to the hospital, and they have some complex medication, to try to talk to somebody about that. That's a pharmacist. Not easy. Mm-hmm. You know, no communication lines there. Or I'm in the clinic and I have a patient that's got a complex prescription that I want to talk to the community pharmacist about that. Not easy. So we have to figure out how to coordinate care among us as well. So that's what I mean. Pharmacy has some, in order to move forward, I think has some inner work that needs to be done. And I think once we do that, it'll move forward. Once we are understanding of each other better than we are now and less siloed, it'll move forward that way.
Yeah. And I like that the general theme there is very much about that, recognizing that we do need so many different tools, and one tool isn't better than the other, one isn't more important than the other, because they need to all coexist, and how they talk to each other and how to build that and kind of break those silos are extremely valuable. And then recognizing from an individual perspective is, what tools do you enjoy, that you're good at, that you can contribute to, recognizing there are other tools that you will also need, but it might not be you necessarily doing it. So I think understanding that coordination is, I think, so valuable.
Yeah, I'd like to add one other thing to that. That's something I learned late in my career. So in the past 5 years, I was able to be part of a PCORI award grant that we got. And PCORI is patient-centered outcome research. Okay, patient-centered outcome research, and it was an organization that was partially funded by the government. And when we talk patient-centered, you know, and patient engagement, their whole thing is patient engagement, patient-centered. And you know, again, those are words. And I thought, you know, no, I'm a very patient-oriented person. Oh my God, did I learn I was not? You know, and so one of the things that resonates with me now when we talk about, I'm a chain drugstore pharmacist, I'm a community pharmacist, and in my independent store, I'm a hospital pharmacist, or I'm a clinician, is we are defining ourselves by where we are, not by what the patient population we're serving needs. And so we need, and that's a very paternalistic, that's not a very patient-centered way, that's not a very patient-engaged way. We need to take away those kind of provider-centric boundaries and think less of where do I practice and more of what is the population that I am seeing need, and how are my services meeting this population regardless of where we are. And I didn't take that up. It was really partially learning through PCORI and the training I got through that, as well as a very wonderful editorial and commentary in New England from Tom Bonheimer, who's been very supportive of pharmacist services, if you've ever read any of that, and Dr. Lee, who's the editor of New England, who said this, who really came out and said, we got to stop thinking about we practice in a hospital, or we practice here, or we practice there, because it's very provider-centric, paternalistic, and not patient-centric. So I just wanted to, that was an aha moment late in my career, actually.
Yeah.
You know.
And that's great, because it coincides with a lot of themes that we talk about in terms of focusing on the actual problem, either problem that you're solving or group or community that you're trying to help, recognizing them, and then trying to think about what position or job or element or how you can contribute, right? We often think about, let's think about the position, the job, the environment, and then think about who we're serving. And right. Kind of like you mentioned, just flipping that the other way. And then recognizing then when you do that, that positions don't really mean much unless it gives you specific power to do things to help the communities that you're helping, which I think is very interesting. Let's talk a little bit now more about what you're currently doing. Are there any current initiatives that you're working on that you're excited about that you'd like to share with us?
Well, you know, it's a new job, and there's nothing like starting a new job when COVID-19 started, because I started right when COVID-19 was starting to escalate. So, so it's been an interesting year. I said coming into this position, I have a little bit of the old and a little bit of the new and a little bit of the current. So let me start with the current. So because my expertise is understanding healthcare reimbursement and billing. I am very actively involved in the work that ASHP, in collaboration with the other organizations, are doing both on the Hill as well as within CMS. So it gives me a very different perspective. I work with a fantastic lawyer who's hired by ASHP, who really understands this well. And in that government affairs, we have a lobbyist. So I think what really has been very helpful and been very wonderful is to hear her interpretation, because she has the legal interpretation, and she says, I'd love to have you because you have the practice interpretation. And so I think that has been a big initiative, and it's been really a lot of fun seeing another side of this whole process. But I am really enjoying bringing the pharmacist point of view here, or bringing the practice point of view from ambulatory practice to hospital health system to community, where I think I've been able over the years to get a good appreciation of what the opportunities are, what the barriers are. And that's why I say I am feeling good about that change. I mean, we still have a lot of barriers and a lot of work ahead of us, but I see momentum that I've not seen. And I think COVID actually helped, because the relaxation of rules, and, they relaxed rules for some things, and, nobody had any terrible things, and pharmacy has stepped up to the plate with immunizations. So it's really, we have a lot more skill to step up to the plate that you're leaving on the table. And I think we have that. So that's one thing. And then a little bit of the old. So there are two major projects that I have on my plate. One is standardized for safety. So this is really going back to my hospital days, which was the first third of my career. And it's to standardize infusion concentrations, because where errors have happened is, let me just take an example, amiodarone. Patient gets started amiodarone in the ambulance on the way, for VTAC or something, on the way to the ER with a concentration. They go to the ER, it's a different concentration. Then they go to the ICU, and it's a different concentration. Or maybe they get transferred to another hospital, and it's a different concentration. So we know errors occur. So we're really doing a lot of work trying to standardize and get the United States health system to adopt these standards. Now you decrease costs, you decrease waste, you incentivize pharmaceutical companies to pre-make them, which also decrease costs and decrease errors. So it's been an interesting endeavor. It takes me back to my hospital days and my home infusion days. But so that's been a very interesting project that we work with expert panels to survey and come up with that. The other one is there needs to be an update on the surgical prophylaxis, antibiotic surgical prophylaxis guidelines. So working on guidelines. So those are a completely different elements that I've done. And I think the future, because at ASHP, telehealth is a big initiative, and telehealth is primarily ambulatory, and they look around and there's the ambulatory person. So I've done a lot of work in just getting to understand how telehealth will impact healthcare and where pharmacy fits in. So those are, a lot of initiatives.
So many, those are very nice. I think the general I think the element that kind of combines all of those is very much kind of the standardization of understanding that the patient isn't just our responsibility in one place or one area. And so your ability to kind of think beyond that. And so you're basically following the patient in different ways. And those initiatives seem to portray that as well. So are there any challenges or obstacles that keep you up at night?
Not much keeps me up at night.
We had another guest leader and I was like, no, go to sleep. I want people to sleep. But, you know, is there any other thing that kind of keeps you thinking? I know the pandemic is obviously one that's top of mind for many people in general, but other, you know, elements that you think about?
Well, I think I'm not a worrier. So that might be why it's really funny because my husband, again, is a worrier and he marvels that I can sleep, so we laugh about that because there are things that keep him up at night. I think, I think it's really what I want to accomplish. I want pharmacists to get paid for the valuable work. I know it's valuable. I have evidence that, our clinics where I was involved in, we decreased hospitalization, we improved patient care. It's not easy to prove. So and I think, it's the cart before the horse. I mean, you need payment and you need proof. I also, even from personal experience, and I think many of you can say that, I want healthcare to be quality and I want it to be easy for patients to use. I want them to understand what's going on. I don't want the paternalistic. I hated it when I got it, either for my kids or for myself. So I think those and I worry about pharmacy for that infighting that I already discussed. So those are things that I worry about, that I really am working hard to mentor others and how they approach. If somebody disparages another profession, like how many times have you said, oh, that stupid nurse, oh, that stupid doctor, oh, that, and don't say that until you walk a day in their shoes. And the same thing about a patient, they didn't do this, or, I think we don't win when we do that. And so those things worry me. I'm a little bit worried about pharmacy, that we figure it out so that we are not lost and we miss our opportunity, because I think we have a big opportunity right now. And so so I think there are things I worry about, not enough to lose sleep because I don't lose sleep, but I think about the wellness issue, and I think a lot of the tactics for wellness I figured out early in my career. When I had 3 babies, I had to figure that out. So I think that's probably why I don't lose sleep. But I do worry about some things, and I try to, within my circle of mentorship and work environment, to kind of bring that wisdom. One of the things about getting older is you do gain wisdom, and that's really nice because you've had all those experiences. And I try to bring some wisdom and examples and why I think why I do.
So that's actually a great transition to building on that wisdom that you have. How do you define success?
That's another one of those hard questions in this. How do I define success? I think I will tell you professionally, what makes me so happy is when I see a young mentee being very successful, and or when I see a student that I've mentored now just climbing, I can't wait to see where they're going to go, because they've already established themselves in their PGY1, or, got the PGY1 or moving to a PGY2, have these unbelievable skills. So I really love it when I see somebody that I saw them, as a wet behind the ears PGY1 resident, and not very secure, very nervous when they present, and now presenting across the country, or I have another one, that another student, a new employee actually, or even my, my staff that were underneath me. I love my staff being successful. And I'm that kind of manager. I really like to do, I like to have my success be their success. Do you know that I've encouraged them? So, and I look at some of my young staff that I've had throughout the years that are just doing fantastic. That to me is really how I measure success. And doing so because of the counseling that I gave them of how to handle certain situations, you know, how to keep your cool, how to not cry, you know, how to, you know, when you get very frustrated, how to handle a difficult manager, how to, you know, how to showcase what you're doing. And one of the things I think we all get trapped in is we don't step outside of our everyday lives. All we see when we're in everyday are the challenges sometimes, and we don't really realize the good work that we're doing. And so, you know, I've had to do that a number of times with some of my staff, and it's really funny. When I have this one clinician in particular who's just done amazing work, and you know, and I'd say, you know, I think you have one of the top practices in the country, and she just never believed me. She was never that. It was hard for her to get secure until. She did a research project as part of a national research project, and that research lead, who had a national heart and lung, you know, I'm just going to avoid names, but you know, very, very well-known researcher said, "You have one of the top practices in the country," and you know, and then I laughed. I said, "See, you didn't believe me." You know? But that to me is success. You know, and I don't know if that's a maternal instinct in me, because it's how you know, it's also my 4 kids, you know, that their success is that I gave them those tools. I was able to help them build those tools. I don't know that I gave them to, maybe my kids I did, but I was help them to able recognize those tools within themselves that led to their success, you know, that confidence, that, you know, way to manage an issue, that kind. And that all came through, you know, my lessons learned, or, you know, failures and successes over the years.
Yeah, I think it's very much tied to, as you're talking about it, kind of that growth mindset of, as you're saying, that you get excited as you see them grow in whatever spaces that they are able to shine and, you know, build their skills within that, recognizing that there's different mentoring or conversations that are had along the way in order to continue to grow. But success is very driven, a lot of the conversation that you've been talking about, and linking a lot to seeing kind of that growth in people. And growth is great because it's a continuous process, right? You can always keep growing. I do want to transition a little bit now into the topic of leadership. So we ask all of our guest leaders the question of, how would you describe a leader? You said, effective leaders have civility and humility without losing strength in conviction, passion, and purpose. Having those characteristics demonstrates that one truly cares about those that they lead. Effective leaders listen well so they understand all sides and explain their decision with respect to those with a differing opinion. This is done based on logical thinking and empathy, and not with anger or emotion. With these leadership characteristics, others will follow because they know their voice will be heard, and they know even in disagreement, the leaders care about how they think and feel. Can you elaborate a little bit more about this and really what's shaped your outlook?
I think it probably also wrote that when things were at a different time in our country, when, in my opinion, we were really struggling with leadership. I think I already mentioned that as a clinician, which was pretty interesting, I ended up getting the management class at school, and I think it's because over the years, I sort of figured out what works and what doesn't work. You know, what works is putting the right person in the right place. That's a leadership decision. What works is to make sure you will get the most out of your staff if they're doing things that they like to do, and that and if they have some autonomy in decision making. I mean, one of the things that I think is a little bit challenging for the pharmacy practice world is we have highly educated base work staff, and many times they're not allowed to make a decision. And when you go to school for 6 to 8 years, you really want to be able to kind of control your day to some degrees and have that decision making, because that's what drove you to get this kind of degree. And then my kids have, 2 of the 4 have gone on to graduate degrees, and I was in different fields. And I observed the autonomy that they were getting with the same amount of education compared to a typical pharmacist. And those were the observations I was making. So it made me look into historically a little bit about leadership and leadership styles. In healthcare, no one's trained to be a leader over the years. How do people that become CEOs, directors of pharmacy learn to lead? They learn to lead by historical forces, like what have people traditionally done. And in healthcare, you will find a lot of traditional management and leadership styles. And this traditional style stems from the 1890s, and it's organize, command, coordinate, and control. And I was thinking about that, I don't like to be commanded and controlled at all. And you think about why in 1890s was this the traditional style, and why is it still exist? And you see many of these elements still exist in healthcare in particular. And in the 1890s, you had 12-year-olds in industry. That was the industrial age. And of course, yeah, anyone who's had a 12-year-old, you have to command and control. But, that's not what you do with a doctor of pharmacy pharmacist. And so you look at new management style, it's energize, empower, support, and communicate. That's the new management style. Harder to do, no doubt. But I think you'll get the most out of your workforce when you do that. So that's kind of that just naturally became my management style, because I didn't like the other one when I was there. And interestingly enough, in healthcare, it is now being recognized, so much so that there's a group of medical schools that have really convened to try to improve training of management styles and leadership styles to be energize, empower, support, and communicate.
Awesome. So are there specific leadership advice or lessons that you can provide our audience? So the audiences are at various stages of their career. So some are students all the way to executives, regarding those that either maybe are seeking leadership positions or thinking about leadership, just kind of across the board.
I think that's why I put in that comment that I said, one is people like to know you care. As a leader, they like to know you care. And so honestly and truly, try to do that and communicate. Not every decision is going to go somebody's way. And your job as a leader is to explain why. People, they're okay if they understand why. They're not okay if you say, do what I say. I think that creates discourse. And so I think that's why I say observe and learn, understand what are the issues, what are the problems, and also understand that most places are, your employees are a bell-shaped curve. You'll have, your rock stars, most are in the middle, but then you'll have your laggers. And I think as a leader, first of all, you have to let them know you care. But at the same time, they can't, you have to provide them the opportunity to succeed. And it's up to them to take that opportunity. If they don't take that opportunity, then you sometimes have to make hard decisions. But at the same time, you can't forget your rock stars. And you have to provide them and delegate as much as you can to them, because you know that they will succeed. And then your middle, and then you can't forget your middle. And so somehow you have to have your strategy for each of those. And how do you succeed in doing that? You have to learn to delegate. Not the easiest thing to do. So, and I think my biggest advice in delegation is don't have in your mind necessarily a way that you want it done without explicitly saying that, but I don't think that goes over well. I think you're much better if you say, I need to have this. These are the elements that I need in it, and then give your very smart staff the opportunity to create it themselves. It may not be the way you did it, but it may still get you the outcome. So be less tied to, if they come and ask you, and you can give them your advice, but let people be innovative and create it their way, and you'll have a much happier staff, and you may learn something along the way too, a different way of doing things.
Yeah, I really like it, and kind of positioning your thought process not only to what you're doing, but what opportunities you're providing others that will also kind of lift you as a leader as well, and kind of create that trusting relationship. So the question before we go into the Q&A that we always kind of end this section with is that we do like to take an opportunity to support one another and recognize the positive influence we have on one another. Can you name a woman who's inspired you, and why did you choose this person? Or it can be two. Most have been cheating and saying two, so. That again was a hard question. I will tell you, it wasn't until later in my career did I have women mentees. Most of my early career, and again, we're talking, and I look in the 80s and 90s, 70s, the 80s and 90s, the first 20 years of my career, my mentors were all men. In every challenge that I had, there just were no women. They weren't there. There weren't many women physicians. There weren't many women clinical pharmacists. There weren't many women in director or leadership positions. So I look back, so that, looking back, that I've been asked this before, and I said, no, it's been men primarily. But now when I look at who do I admire in pharmacy, and I would say, quietly, one of the most significant pharmacists in the country is Ann Burns at APhA. I would have to name her. She is she doesn't bring attention to herself at all, but she just knows so much about the profession, and is somebody that is my go-to when I want to bounce an idea off. And then I told you about Starlin Hayden Greeting, who's a pharmacist here in Illinois, who just has energy galore and has such a passion for pharmacy and the profession that she's just a joy to be with. She energizes you when you're down. She just keeps it all going. And again, somebody that I can talk to that I think, that I can bounce things off. And then, there's a whole list of that were my mentees that are my colleagues now that I could list too, but I'll stick with those two. I like the distinction that you made, because I think this also comes up to, I think a lot of us have said that too, and I've said this before, many mentors that I've had have been male mentors, but I think too, like you said, there are also those that you might not maybe interact with on a day-to-day basis, or might not have the official title of your mentor that inspire you or make you think a little differently, or really like what they're doing in terms of the impact that the work that they're doing for their communities or their profession. And so I think those are always nice to kind of have, because we often think that they have to be a formal mentor or they have to have that. But I think there's so much inspiration stems from various types of relationships for sure. So we do have a question here around that appeared. Okay, so around medication safety. So what lessons have you learned from medication safety that can be applied outside of pharmacy?
Outside of pharmacy? I think, I think what always frustrates me, I guess, is how we educate patients to be safe. And it's something that I observed when I really started doing this. And it really was once I got into ambulatory, because in the hospital, we thought we were doing a smash up job because we told them all the stuff before they left. And it wasn't until I got out of the hospital that I realized they probably retained 1% of all that information. And then once I started working with patients in the ambulatory setting, and I've worked with underserved, and I've also worked with highly educated patients. But what I've learned is, and you know, we're not trained as educators, is that it reminds me of learning reading in first, second, and third grade, where you start at, you know, blue, and then you went to purple, and then you went to red, you know, and it reminds me of that stepwise approach, because I would try to educate patients on what your blood sugar should be, what to do when it's too low when you test it or too high when you test it. And, you know, and I'd quiz them when they come back to visits, and we'd have monthly visits. And I realized that it took like almost 3 months for them to get it down pat. And it sort of like it took about 3 months to move to the next step in reading. And I think we assume by just pouring all this information in that everyone's going to get it. And so I think we have to really better understand adult education, especially adult education with low literacy and low health literacy. And then at the same time, and that was a lot with my underserved, because, you know, frankly, how well they're using their medications probably fifth on the list. They're worried about getting evicted, whether they have shoes and food. But then when I went to the more affluent population, it was interesting there too, because nobody was really explaining things to them. And it was amazing to me how they adapted, and sometimes adapted wrong, so they still ran into trouble. But what the level of education and reinforcement that they need. And so even though they could absorb it because it was higher on their list to do, it was almost the same stepwise pattern. So I think medication safety, when we look at where the problems are, it's in ordering and it's in patient use and administration. Those are the two highest areas. Ordering, you know, that's why we need to be members of teams. How they're used is really helping patients figure it out. So they don't make the decisions they make. And if you look at the decisions they make, we'll think, oh, that was really stupid. But they don't have the background you do. So you really have to help them make best decisions and be available for questions. So those are my medication safety. You look at the data. The error is not dispensing. It's still areas to improve, but we're the lowest in the medication use processes where medication errors occur.
So we only have like about a minute or so left. Are there any other closing remarks or final thoughts that you would like to add?
I just, you know, I think, you know, I didn't set out to do this, to be here. I am thrilled that I am privileged to be here. And I think that's maybe a lesson. You know, sometimes when you go after something and that's your focus versus just doing your passion and doing the right, you know, doing what makes you happy, what makes you fulfilled, somehow you end up here. And that would be my closing comment.
Yeah. No, that's actually wonderful, because like you had mentioned, and you've mentioned this kind of throughout multiple times in terms of what your real focus is, and identifying that and making sure you kind of go after that being kind of the focus and who you're serving, whether it's even building your teams or helping your patients. And I think having those types of focuses, those broad ones, and being then open to new opportunities or new conversations like the one we're having, which we're so happy that you're a part of. But I think that speaks to a lot of kind of adding to that, you know, adding to the contributions that you're making overall, right? And without even thinking about it, because it kind of opens doors in an exciting way, but for sure. But we are definitely very privileged that you are part of this series.
Thank you.
And very happy for this conversation with you. This has been very nice. And so on behalf of Salus Vitae Group and myself, I would like to thank you for joining us today, Mary Ann. It's been an absolute pleasure. And I think that the contributions that you've made, not only to those mentees that you have and to your students, as well as to your patients, will continue to show many years to come, even after your retirement, for sure.
I appreciate it.
Of course. So now we have several other exceptional leaders in the coming weeks. So of course, if you've done this before, you know the best way to register for all of the events is salusvitaegroup.com. And so we look forward to seeing you also at future events. And of course, please feel free to tag us at Salus Vitae Group if you post anything about the events so that we can see what you've taken away and how you've benefited. So thank you all for attending, and we hope to see you at the next event.
Thank you so much.
Thank you.
Bye-bye.